Today's Inside Tract podcast is part of the Global Perspective series, which is brought to you by the AUA International Programs Department. We'll hear from scholars of the past and present as they talk about what they've learned, how they plan on applying those lessons, and the impact of international collaboration on their professional growth, research, and patient care.
Welcome to the AUANews Inside Tract. I'm Christopher Jaeger, and I'm a pediatric urologist at Corewell Health in Metro Detroit in the state of Michigan.
Thanks, Chris. And I'm Dr. Priyank Yadav. I'm a pediatric urologist. I trained for many years in Sanjay Gandhi Postgraduate Institute of Medical Sciences, India. And more recently, in December 2025, I actually moved to Chicago and joined the University of Chicago Homer Children's Hospital as a pediatric urologist.
This week on Global Perspectives, we're turning the microphone on each other to share what it's like to experience pediatric urology across two different healthcare systems, India and the US. Go ahead.
Yeah, and we'll talk about the clinical practice, training, cultural differences, and what we have learned through this truly bidirectional exchange.
Wonderful. So Priyank, when you were selected as Chakrabarti Reddy Scholar, what excited you most about coming to the US?
Well, this selection itself was a real honor. This fellowship has such a meaningful legacy, and it was specifically built to bridge the Indian and North American urology. Uh, I should mention here that the fellowship structure has evolved a bit. For a long time, one of the two scholars was specifically reserved for pediatric urologists who would visit Cincinnati Children's Hospital and see the procedures and meet the team over there. That dedicated pediatric slot isn't part of the current structure anymore, but both positions are open to any specialty. So when I was selected in 2024, I'm glad that program gives space for pediatric urology when it did. But to your question, what excited me the most was the chance for genuine immersion. Um, Rather than simply observing techniques, it was more like understanding how different systems work, coming from a totally different environment and a system to see how protocols are designed, multidisciplinary teams function. Uh, we did manage a lot of complex cases back in India, but then what that complexity looks on the other side of the resource spectrum and how the two could inform each other, that was the most exciting part for me. But what motivated you to apply for the AUA and USI Exchange Program, and why specifically India?
That's a great question, Priyank. I definitely had noticed in my, short time in pediatric urology that, a lot of the thought leaders, especially in hypospadias care, were in India. And, I was always very eager to learn more techniques and to learn from the pioneers in our field during training, and I wanted to continue that in my young career. And I honestly, hypospadias in particular is a difficult syndrome to manage sometimes, and I wanted to learn from the best. That was part of my motivation to apply into India directly. But I was very motivated to see how pediatric urology is practiced outside of the U.S. And Dr. Asim Shukla, who has been going to India for a number of years for his bladder exstrophy workshop in Ahmedabad, definitely inspired me to do the exchange program, since he's a big proponent of that program and was a secretary of the AUA at the time. And he also is an inspiration to me just as a pediatric urologist in the US. So, I wanted to learn more. I was young in my career, still am, and I wanted to learn from the best.
Yeah, and it was great to actually see you in Lucknow for a week. Had a great time together. Still, it's almost like 2 years from that time, but feels like it was very recent.
What assumptions did you have about pediatric urology in the US, and how did the reality compare to what you actually experienced?
Um, I initially, when I came for the exchange program, I thought technology would be the most transformative thing. It was impressive, no question, but actually what surprised me the most was the system around the surgeon. It was totally different. Back home, the pediatric urologist was a central decision maker across the entire care episode. But in the US, you're embedded in a highly coordinated team of nurse practitioners, pediatric urology nurses, patient navigators, social workers, anesthesia coordinators. So the depth of the support structure changes how you practice. And before I arrived, I hadn't fully anticipated that. Um, I also didn't expect how much time and effort goes into the communication part of the clinical care. We all talk about shared decision making, but how that actually happens with the families, what kind of questions come up. It's truly amazing to see that part. It's a lot of different social aspect that we got exposed to, the documentation, the consent conversations. Uh, in India, the trust between physician and the family is often implicit, so the pace of conversation is actually faster. But when you have a formalized architecture around that trust, although it protects the families as well as the patients in important ways, it requires a different set of skills. Uh, that was actually good to notice. And coming from, as I mentioned, a totally different society and environment, uh, that was the first exposure, which is now helping me in my current practice. But before traveling to India, what did you expect from pediatric urology practice, and what surprised you when you arrived?
Yeah, I honestly didn't really know what to expect. I presumed at least in some parts of the country that I was visiting that I would see how the practice, performs in a lower resource setting. And then at the institute, I honestly didn't really expect much difference between what I had experienced in the US, given its, extra resources and the expertise of the faculty there. Um, and what I experienced was honestly like truly amazing pediatric urologists doing excellent work, sometimes in lower resource settings, sometimes with equipment that I think that they would love to have updated. But I also experienced, like, for example, I experienced Dr. Ansari and team doing a robotic pyeloplasty just like I would do in my setting, no issues. So, I mean, from my perspective, I didn't actually really notice a ton difference other than I guess how the patients present. Patients seem to come from, right next door to the hospital and hundreds, sometimes even thousands of miles away. And they come with, packets of, notes, x-rays, ultrasound studies, all in like a portfolio of sorts. And I know that's not unique to India, but that was amazing to see because they're honestly very organized. But also it's very different than our electronic medical record world where that is all encapsulated on a computer. So it honestly like changed the dynamic of the patient family urologist relationship. And it was a lot more intimate. There was a lot more clinical decision making on not necessarily on the fly, but like in real time. And it was honestly pretty cool to witness. And you could see how how many patients were needed to be seen, how busy you guys were, but also like how your workflow is just different. But the surgeries, my gosh, they were incredible. There was a lot of expertise, and there really wasn't a whole lot different between the two settings.
Yeah, and as you mentioned about the documentation, reminds me when I went back, I wanted to I wanted to do a word search
Mm.
on those documents. I couldn't because they were in my hand. I couldn't do like
No?
you search in the Epic and yeah, and I look, oh gosh, I wish I had that Epic thing with me. But you're right, like so many, and even here when I'm going through the records in the Epic, sometimes I wish, oh, if I had all those documents in sequence, I'd be able to see. So there's something to learn from both systems, and it's incredible.
From your perspective, Priyank, like what is the biggest difference between pediatric urology practice or training in the US versus India?
Oh, yeah, training, I would say, Chris, is quite different. The most fundamental difference is the training volume. Uh, and I think it's common for all developing countries. The urology resident encounters things like hypospadias, PUVs, complex renal anomalies, week after week, year after year. The sheer density of exposure accelerates a kind of surgical maturity very quickly. The American training in general is longer, more structured, more protocol driven. Uh, this is good because it creates consistency, a sort of culture of evidence-based practice. But on the whole, the case exposure per training is actually significantly lower. The other thing which you also mentioned is about innovation.
Mhm.
The resource constraint forces a kind of adaptive creativity. The surgeons develop elegant low-cost solutions to complex problems because they have to.
Mhm.
And uh, while in the United States, a lot of innovation tends to be technology driven and infrastructure supported, uh, the type of ingenuity that comes from the other spectrum, other extreme of the spectrum, is incredible. And just yesterday, we were supposed to, like, we were trying to get a Foley catheter in over a guide wire, and we tried some, innovative techniques to get it done. And as I tried that in the operating room, everyone realized, how do you do that? Like, how does it even happen? And, sometimes it does without needing many specialized things. So yeah, just to tell you about how this kind of cultural exchange uh, eventually helps the patients. I think that is the most incredible part.
Yeah. Yeah. I mean, I think that that is, a tremendous insight, and I'm glad that you're here.
Thank you. But Chris, while you were in India, what clinical approaches or decision making stood out for you?
It's a good question. I think, just taking from, a specific example and then like a kind of a mindset shift that I had as a result of going on the trip, I would say specific, to, maybe not so much developing countries, but to countries with, warmer climates, and treating hypospadias, especially redo hypospadias.
Yeah.
I learned in my time in India, that, use of buccal mucosa grafts the culture around that is completely different than in the US. And that was a big surprise to me. And yet again, it's a result of like understanding your setting. Like they're very aware that buccal mucosa grafts just don't take nearly as well or don't survive nearly as well and aren't as usable tissue, which is literally the exact opposite in the US.
Yeah.
And the surgeons adapted to be very creative in fixing hypospadias and certainly redo hypospadias. So that actually directly helped patients when I went on a global health trip to
Mm.
sub-Saharan Africa, and we were treating, you know, hypospadias patients in that setting. And I took from my India experience and really avoided buckle unless it was absolutely necessary. So that was a direct translation of that experience. But a mindset I walked away with. I'm a young faculty member. You definitely want to ensure good outcomes and that you're not taking on too much. You're not
Yeah.
going above your skill level. And I still do that. Like I still abide by that principle. But I saw you, I saw Dr. Ansari, I saw many other pediatric urologists who were not afraid to do what was necessary to help patients, no matter how complex it was. And that mindset, honestly, was pretty inspiring. And it's something that I've definitely taken back, and I've taken on much bigger cases, complexities, and things happen, but for the most part, it's really paid off for my patients. So um, that's one thing I'm really grateful for from you and from Dr. Ansari, especially for kind of inspiring me to not be afraid.
Oh, thank you, Chris. And actually, talking about similar experiences during my observation, uh, there is a tendency to, to sort of run away from bad situations and difficult conversations. But what I realize is when things go wrong, for example, in North America, most of the surgeons stand by families, communicate everything, and the families are very understanding. So this I actually applied directly in my practice. And as you know, hypospadias is one of the most difficult things. You can never have guaranteed outcomes. So there was one patient in which in this patient there was a skin flap necrosis, and we investigated extensively, didn't find a reason. But then initially the family was very concerned. So I actually learned from my experiences and stood with the family, contacted them directly, and everything went in the right direction. Eventually the wound healed really nicely. But that period of you can say that emotional trauma that the family was going through, and the fact that I was able to help them with conversation, answer a million questions without getting frustrated, I think the family had a lot of confidence after. And it sort of made me feel much better that eventually I was able to help them in not just getting the surgery done, but also making sure that I was with them along the way. So for the subsequent stage of the procedure, when they came in, they were extremely well informed. They were very happy. Things worked out fine. The guy's doing great now. But yeah, this experience taught me a valuable lesson that obviously changed the way I looked at things afterwards. And I think I continue to do that even now. I
Mhm.
make sure that I communicate everything with the families very well, even if there are adverse outcomes. The patients as well as the families are very receptive to open conversations, open, honest conversations. So yeah, that is was something that I really appreciated once I saw this during my fellowship, the observership. Sorry.
Well, that's outstanding. I'm sure your patients and families are quite appreciative of that communication style. It means the world to them, I'm sure.
Yeah. Uh, so while you were in India and you saw different things going on, is there a technique or mindset or workflow that you've already brought in your current practice? You mentioned about the trip to sub-Saharan Africa,
Mhm.
but in your current practice, is there anything that changed?
Yeah, that's a good question. I maybe not anything that changed specifically other than like the buccal mucosa example.
Mhm.
I would say I honestly really did respond well to the mindset shift. I really did. And, you know, um, I was taught, a very specific way as to how to manage hypospadias. And, you know, going to India really opened my eyes to, yes, that technique that I was taught may be appropriate for 60, 70, 80% of cases, but it may not be the right decision for the other 20%. And you really need to have like an encyclopedia of either experiences or knowledge or an atlas in the back of your mind ready to
Yeah.
be used when you see differences in anatomy or when you're doing redo surgery. And honestly, like that is what I took away the most is like literally seeing different techniques that I had never seen before in hypospadias or just thinking about the conversations, I heard at USI or talking with hypospadias experts. That's really what I brought back. And to be honest with you, for like proximal hypospadias, for example, I was taught, two-stage Byers flaps every single time. And I still do that, but I also do other techniques as well. And I think it wasn't necessarily just India that resulted in that change, but it was a big part of it.
Yeah, on that I agree with you. I also love two-stage bars. That's
But it's not the only tool in the toolbox.
correct. Uh,
So Priyank, what was it like adjusting to life and work outside of the hospital?
uh, Inside the hospital, I felt at home, honestly, because that's what we live most of our lives like.
Mhm.
You're either in the clinic or in the operating room. So it actually felt like home. You can say medicine is a universal language. So outside the hospital, there was a more gradual adjustment. I spent about 3 weeks in Cincinnati. So during that time, there were some areas to explore, from the downtown to the zoo. So there was quite a life outside the hospital, and it was May. So the month of May is beautiful. So I enjoyed. Uh, but now looking at Chicago, it's a great city. Coming from Lucknow, which is really really hot, the weather here is much better. Actually, we just had winter, so now everything is so nice green, and it's an amazing experience. And both places have a very different culture. So Lucknow has uh, deep history and culture, and some of the, I would say, very different variety of food items that I now miss here, of course. But then there's so much new to explore. So I think that mindset of trying new things, it really helps in adjusting to new way of life as well as work. Uh, One thing that I sort of need to learn as I'm taking this journey along is to adjust with the separation of the professional community back home, the colleagues and the trainees I've been with for most of my life. Now I have to start from zero. So uh, that is not difficult, I would say, but then of course it brings in new challenges. The good thing though is I did my fellowship from Sick Kids in Toronto, and after 2 years of that fellowship, going back to Lucknow and reuniting with my colleagues brought in really nice memories. And I continued to collaborate with people in Canada. So now when I come to United States from Lucknow, I actually continue to work with the colleagues in Lucknow and Canada. So it's only getting bigger. The network is growing, and it's like the world is a very small place. Every week or every other week, I bump into people who have connections, either Canada or India, and it feels like, oh, we know each other indirectly. So I would say the adaptation or adjustment is like an ongoing process, but it's an interesting journey, and I'm really excited to be going through that.
Yeah.
Uh,
Well, we will welcome you to the U.S. Pediatric Urology family with open arms.
Thank you so much. But what was the cultural experience for you in India?
Oh, there's many. Gosh, in Lucknow, I remember visiting the residency, like the old British quarters. And but really, like the main cultural experience that I took away from is at the USI conference, they had like a light show that talked about the or depicted the like history of India, which was outstanding, and it taught me a lot about the country and the pride you could see in the faces of the locals was pretty palpable, and it was just wonderful to learn about the historic country. And then, you know, last but certainly not least is the food. I mean, especially in Lucknow, I will admit that the food in Lucknow definitely won the prize. Anywhere I went in India on that trip, definitely had the best, specifically the kebabs. So.
Yes, I miss them, honestly. Has your experience changed the way you look at global collaboration or future exchanges?
You know, I think it is vital for like the AUA in particular to continue to support exchanges like this.
Mhm.
I'm very supportive of the not only exchange of ideas, but the nurturing of young faculty like you and I who are motivated to continue their, arc of development, faculty development, and are eager to grow and to grow in ways that engages with people outside of, your context at home. I think it already has started like some collaborations when it comes to research or exchange of ideas or having somebody to bounce ideas off of when you get a complex case. I've already used Dr. Ansari for that before. So at the end of the day, it improves patient care, it improves my satisfaction with my job, and I think I know it improves relations between the two communities of pediatric urology or urology in general. And if there's other exchanges or opportunities to go to other countries, on behalf of the AUA or with any other organization, I'll be wide open to. But I also encourage others to be open to that, because it really was pretty inspirational in my young career, and helped shape how I do things back at home in the U.S. today. So I highly recommend. What about you, Priyank? What advice would you give to pediatric urologists considering an international exchange?
Uh, I would say mm, any young budding pediatric urologist should go with the curiosity and stay with humility. Uh, there is a very limited amount of time you can spend. So you have to know beforehand what you want from that place. So I would say do a little bit of research, what you want, what that place offers, especially now that you can actually choose which institution you want to go and visit. It's not limited to one particular institution. So 2 to 3 weeks pass really quickly if you don't have the plan laid out in front of you. uh, it would be nice. The memories are great, but then you gain less from it. So it has to be planned like a proper, uh, like even like a vacation. Then it has to be very detailed in terms of planning. And it's always good to reach out to the faculty in that institution, introduce yourself that you're coming and you're looking for certain specific things. So even at times there may be some cases that they can schedule during your stay. So that will be immensely beneficial because the complex cases are not done routinely, so they are spread far apart. So sometimes that helps. Uh, One should invest seriously in relationships because, uh, as you mentioned, there is one academic exchange, but then more importantly, there is that human connect, and they help you in ways more than you can think of, especially if you're stuck in some problem. Uh, so, yeah, you can always reach out to people and they can guide you along the way. Uh, so once I went to Cincinnati, met a lot of people. I just continue to meet them in every conference, and it sort of allows me to continue that conversation, and through them meet more people. The more people you meet, the more ideas you get. So overall, this international exchange is not just a one-time event. It's like an opportunity to build your network, keep meeting people, get new ideas, and improve your practice and help the patient. So I would say it's a win-win for every person, even if that person is not directly involved in this exchange program, which is the patients. And finally, it's about bidirectionality. So when you go and learn something, you also bring some new ideas. So the place can also gain from your visit or experience. Uh, yeah, that's pretty much about it.
Yeah, you you kind of stole a lot of the things that I wanted to say about the program's value, but that's okay. My there's a lot of value to these programs, but I think the main value to the exchange programs is exposure to leaders in pediatric urology who work, live, and operate in a different context. And those leaders can serve as mentors, friends, and colleagues to you in your career and in life, and help you grow. I would also say, I think the value is also exposure to patients in a different context, right? And patients
Mhm.
teach us a lot about, our specialty, ourselves, and the world. And I am extremely grateful to, have helped witness a lot of patients undergoing excellent care in India that have helped my own patients in the U.S. So I'm very grateful for the exposure and the value that the exchange program gave to me.
It was nice to sort of relive those things, although it was 2024 and now we're in 2026. But thank you so much for having me, Chris. And thank you to everyone listening to the Inside Track. If this conversation sparks something, I would like to ask you to look into this exchange program. And definitely, this changed the trajectory of my career. And I genuinely believe that programs like this can help our specialty grow into a global potential, and not just pediatric urology, for all different specialties within urology, and eventually make a difference. Thank you.
Thank you for joining us on Global Perspectives. Take care.
This has been Global Perspectives. an AUANews Inside Tract podcast brought to you by the AUA International Programs Department. For more information about AUA's International Exchange Program, visit auanet.org/exchange.